welcome to my channel. My name is Krista. I'm an international mom of two, a dental hygienist turned midwifery student, and here on my channel I talk about all things motherhood, midwifery, pregnancy, and childbirth education. So if these things are of interest to you, please follow along and get ready to birth and bloom. Hello, welcome back to my channel. I'm so happy you're here. So what are we going to be talking about today? Today I thought it would be a nice idea to talk about my very first birth story. This was a birth story that took place in December 2020. It's my first baby girl, and I want to talk about the labor induction process. So I want to preface this story by telling you that this was 3.5 years ago, and I have learned so much since then, and good and bad, but I would not change my first birth experience if I had the opportunity to. It was the birth experience that I needed to put me on my journey, and I want to talk about, the pros and the cons and the risks and benefits to labor induction and why it might be medically indicated for you, and if it's being suggested for no real medical need. I encourage you to do your own research, maybe starting with this video, and really sit with if it feels right to you and your family, okay? So about 4 years ago when I became pregnant, it was April 2020, pandemic times, wildness, okay? So this was before I knew that I needed to become a midwife, and I did what most women do. I found out I was pregnant, and I talked to my sisters and their friends about their birth experiences, who they saw as their practitioners or their care providers, and what hospital they went to. At the time, this was long before I knew much about midwifery. I, just like most women, decided that, okay, I'm gonna have my baby in the hospital. And especially during the pandemic, it just seemed like the obvious choice. So my sister, she had recently had her babies, and my other sister as well. And I decided just to go to the practice that my sister was seeing and that I had been going to for my normal GYN annual visits. So this particular practice was a group practice. There were a couple OBGYNs, and there was one practice midwife. And some of this is going to be a bit repetitive to what I've talked about in previous videos, but this is going to be the full encompassing story of my personal birth experience. I got a little bit more information about this group practice, about the hospital that I would deliver in, which is, fun fact, the hospital that I was born in 30 some years ago. So that was really special to think about, like, wow, I'm going to have my first baby where I was born myself. So I learned a little bit more about this group practice, which setting I was going to go to, and for whatever reason, I felt really drawn towards scheduling my first appointment with the practice midwife. And if you are going through the hospital setting and you are in a group practice, for example, the midwives within that practice are going to be certified nurse midwives, or CNMs. So the midwife that I saw throughout my pregnancy's name was Rachel. She was a CNM. Prior to becoming a midwife, she was a labor and delivery nurse. And truly, she was just wonderful. I attribute the positive experience that I had because of her, a lot of the own work I did for myself, but she was a familiar face that I trusted and that led me to a positive experience. Throughout my pregnancy, I went to this group practice. I saw a couple of the OBGYNs, but most of my appointments were with my midwife, Rachel, which I loved. This is not a dig at OBs, but I personally just feel that midwives tend to have a warmer rapport. Generally, especially outside of the hospital system, your appointments with a midwife are going to be much longer than they would be with an OB. I think the average OB appointment is like 7 minutes, unfortunately, 7 to 10 minutes. And if you're seeing a midwife in the community setting, which is a home birth or a birth center, generally your appointments are going to be anywhere from like 30 to 1 hour. So that being said, though she was in the hospital system, and her appointment windows were small, I still felt like I really could talk with her and build rapport and get to know her get to know me and my baby. And that set me up for success when it came to giving birth. Okay, so throughout my pregnancy, I had a normal, healthy, low-risk pregnancy. Around 36 weeks, my blood pressure started getting a little wonky, as I like to say. So sometimes there are conditions called gestational hypertension and preeclampsia. Preeclampsia is something that is of concern, and increased blood pressure readings are associated with a risk of preeclampsia. I, however, thankfully did not develop preeclampsia, but my blood pressure towards the end of my pregnancy started to rise, and I'll get into what that means. So because it was a pandemic, some of my visits were virtual, and I had a blood pressure cuff at home. So I was monitoring my blood pressure at home, and I noticed, like I said, around 36 weeks, my blood pressure started creeping up. And this was on my radar because my sister had preeclampsia with her first baby, and like I said, an increased blood pressure or hypertension is one of the risk factors in developing preeclampsia. So this had been on my radar, and I am a dental hygienist, but I'm very familiar with blood pressure. I had to take it all throughout my career, and I knew that my readings were not looking fantastic. So when I went in for my 36-week prenatal appointment, I made sure to let the nurse know that my blood pressure was starting to creep up. And also I have a bit of white coat hypertension, meaning I definitely have an elevated blood pressure when I'm anxious or nervous or really just going into the doctor's office. And a lot of it is really mental. So like if you're thinking about getting your blood pressure taken, it automatically is going to elevate it. So I let the nurse know that it was starting to creep up at home. And the first reading she took was high. She didn't tell me what it was. She said, okay, just relax. I need you to lay on your left side. Breathe, calm yourself. I'm gonna come back in a couple minutes and take your blood pressure then. So when she returned, she took my blood pressure and it had dropped down to a reasonable reading. And generally, gestational hypertension is gonna be at like 140 over 90, if I'm not mistaken. So if one of those numbers is at that limit, they're going to monitor it, and they're going to need at least 2 of those readings on record before they recommend like a labor induction or something like that, or getting baby born. So that appointment at 36 weeks was high, but when she retook it, it had calmed back down and had lowered, and then my appointment went fine from there. And then 37 weeks was coming. I was taking my blood pressure at home, and it was kind of going up and down. Sometimes it was okay, but other times it was definitely creeping up. And by 37 weeks, I had my appointment with my favorite midwife, Rachel, and it was, once again, high. Okay, so because it was high in the office, I don't remember what the exact reading was, but it was high. And I think the same thing happened where they let me relax, lay on my left side, and took the measurement again. They took the blood pressure reading again. So she comes back in, and she says, I think we're gonna have this baby. I think we're gonna have this baby soon. And I was like, what? Like, I, in my mind, was in a way wishful thinking that my baby would come early. My first pregnancy felt really hard. It was, I felt really tired at the end. I felt really big, and I just was anxious to meet my baby. This was not the plan. I never wanted to have a labor induction. I had educated myself about the process, so I wasn't super fearful of the idea, but I expected to go into natural spontaneous labor. That was the plan. So when she told me that it was probably going to be an induction, I was like, oh, shoot. I was not expecting that. So essentially, this was on a Wednesday. And she's like, I'm going to send you down to the hospital. We're going to put you on the monitor, which is called a non-stress test. So essentially, they put the 2 belts on your belly. One is to measure contractions. The other is to check your baby's fetal heart rate. So you go down. I went to the hospital. They put the belts on. I was on the monitor for a while. And at that point, once I was settled, my blood pressure was not an issue. It had calmed down. Like I said, once I was like in a relaxed state, the blood pressure reflected that and came down as well. But it was like the initial visit and the initial going in is what really shot it up. So when I was on the monitor at the hospital, everything was looking good. My baby was looking great. My blood pressure was looking fine. So essentially after that visit to the hospital, I was scheduled to go back into my office on Friday to do a blood pressure check. And I think this was a big blessing because essentially Thursday was my opportunity to mentally prepare that this baby might be coming early, to hopefully get the rest that I needed to prepare for a labor induction, and just mentally do the work in preparation for this baby to be coming early. I was only 37 weeks and 4 days. So like we've talked about in other videos, your due window is from 37 weeks all the way to 42 weeks. So I fully expected to go past my due date. So the fact that she was coming at 37 weeks was early. 37 weeks pregnant is considered early term. Your baby is term, but 37 weeks is still early for your baby to arrive. Generally after 37 weeks, there's not much concern. Usually the fetal lung development is where it needs to be. But you know, there are cautions to be aware of. So I went in for my follow-up visit on a Friday, and once again, blood pressure was high. And this was with a different OBGYN, and she essentially called it, and she's like, okay, yeah, we're gonna send you down to the hospital to get induced now. And so that was like alarming, but also I felt peace about it because I had talked to Rachel, my midwife, about it 2 days prior. And what she told me is that if I were to be induced on that Friday, she was the provider on call. And that set the scene. So because I knew her and I had a relationship with her, I knew that I was going to be in good hands, that though this was not the plan, I had faith that this was all going to work out okay, and this was the birth experience that my baby and I were going to need to have. So my family and my husband knew that this was likely going to happen. Called my husband, said, hey, they think I need to be induced today. We have to go to the hospital. Okay, so I'm talking to you about my personal experience. I am not a labor and delivery nurse. I'm not a CNM. I am not an obstetrician. This is going to be my personal induction experience, the methods that we use to get my labor initiated. And once again, I am setting to be a midwife that works in the community setting, meaning I will be practicing in the home birth world and the birth center world. And both of those settings don't do these sorts of medical induction. So this is going to be coming from my personal experience and what I've learned from there. Okay, so I was in triage, I met with the doctor there, and the plan for me to move into my induction was to have cytotec or mesoprostol, that's the generic name, and the Foley balloon or Foley catheter you may hear. So I knew going into my induction that I was already starting to have some dilation and having some effacement. I think I was like 1.5 centimeters dilated, and I think I was about 80% effaced. The reason I say this is generally if you have had some dilation and some effacement leading up to your induction, your cervix is going to be more favorable. There's something called a Bishop score. I don't know the exact science to it, but essentially the score is going to be determined based off of the effacement and dilation and the softness that your cervix is leading into an induction. Meaning, if you have a more favorable cervix, generally the outcome of the induction is going to be smoother. Okay, so I knew that going into my induction, I had already had some cervical dilation, I had already had some cervical effacement, and that I was considered to have a more favorable cervix, so that is something to note. So the first step was to give me a dose of cytotec vaginally. They essentially put the tablet up close to your cervix, as close up to it as they possibly can, and do the Foley balloon or Foley catheter. So cytotec is a cervical ripening agent. I just want to let you know a little bit about it specifically. It can be taken orally as an oral medication, or like I said, transvaginally inside the vaginal canal up by the cervix, the cervical os, which is the opening there. So cytotec is an oral medication that is commonly used in oral labor inductions in women to work to help soften the cervix to allow easier dilation, known as ripening, and producing contractions. In most cases, Cytotec is safe and a reliable medication that can make labor easier for women when administered correctly. I want you to do your own research about these medications, these techniques that I'm explaining to you now. There are risks and benefits to everything. Medications included, Cytotec included. One risk of Cytotec I know is uterine rupture, which is a serious one. So do your research. This is not the end all be all, the information that I'm telling you. It's just giving you a little head start to do your own research if in case labor induction is necessary for you. So I had one dose of Cytotec, and then I had the Foley balloon inserted. So I want to show you what the Foley balloon looks like. It is a little catheter balloon, little hose that goes up into and through the cervix, and on the one end facing the baby, a balloon is inflated. So I'm going to hold this up. Hopefully you can see it. So they thread the catheter up through the cervix and then inflate the balloon with a saline solution. And this essentially acts as a mechanical retention to help dilate the cervix. I think it gets you to about a 3 centimeters of dilation. So here on my dilation wheel, you can see 1, 2, 3. I think about, according to my quick search, and that sounded right to me, it's going to get you about 3 centimeters of dilation. So the way it works is it gets inflated on the internal side into the uterus below the baby's head, and it's going to inflate, and then they're going to kind of pull down on the hose itself, and they tape it to your inner thigh with traction. And I had known from others about this experience, and they did not speak highly of it. They said it was really painful, uncomfortable, and they had it in for hours. Thankfully for me, I had a relatively okay experience with it. The doctor that inserted it took a couple tries. And then once it was placed and taped to my thigh, it was okay. But you are gonna feel a pulling sensation, and it's pulling down on your cervix to help open your cervix to around that 3 centimeter mark. So yeah, that's just something to know. It sounds kind of intense because it is. It's a mechanical opening of the cervix. But thankfully for me, it worked well with the Cytotec and the Foley. I dilated to that, whatever that magic number is, in about an hour. So that was really quick considering, because I had heard stories where people had it in for hours. So that gave us time to eat. We got moved to like an intermediary room where it was not triage anymore. It wasn't full on like labor and delivery. But during that time, essentially a nurse will tug on the catheter, and if it pops out, you've dilated to that period. And if it doesn't come out yet, you're not fully at that dilated window. So the nurses I was with were incredible. She popped it out. She's like, amazing. Like, she was so kind, so sweet. And she had just kind of reassured me that this was going to be a fine experience and that I was in good hands. So during that time, my husband and I got to have a meal together, and we kind of just chatted. Essentially, it was approaching their shift change. So they did not want to move me to my official room until the shift change had happened. And the plan of action was going to be they were going to start me on Pitocin. So we had our meal. It was time. They took me to the labor and delivery room. And that is where the party got started. So you will hear Pitocin, 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 Pitocin. What is Pitocin? So Pitocin is the man-made synthetic version of oxytocin. Oxytocin is the key hormone in labor. You will hear oxytocin as the love hormone. Oxytocin is what stimulates those uterine contractions, and Pitocin, in theory, works the same way. There is a caveat to Pitocin. Pitocin does not have the same effects on your body as oxytocin. It kind of snatches up the receptor sites on your uterus to do the contracting. However, it does not have the same effect on your brain, meaning with normal labor contractions from oxytocin, your body is making amazing endorphins. These endorphins are nature's painkillers. So with each uterine contraction, your body and your brain is signaling to make these amazing endorphins to make you cope with the labor contraction pains better. So let's get into it. I had gotten started on the Pitocin drip around, I think, 7 p.m. and they had me on the lowest setting. This was good. So essentially, though you're not having a normal labor that's starting spontaneously, they try to mimic nature's design by slowly easing you into Pitocin. So they had me on the lowest setting and it got going quickly. I will say after the Cytotec and the Foley, I was starting to have some contractions on my own, which is a good thing. So the Pitocin really leveled it up, contractions were coming. And I will say that Pitocin contractions are painful. Just to be frank, this is not to scare you if you need a labor induction, but now that I've compared the two where I had a completely unmedicated birth and a hospital induction, I can first-handedly tell you my experience that Pitocin contractions were much harder to cope with than normal oxytocin contractions. So the contractions are really starting to come. At one point, I think in my hospital, they go, I don't know the full levels of what it is, but they had me at the lowest setting and then they bumped me up to the next. And they had leveled me up for literally 30 minutes. And on the monitor, you can see the frequency and the kind of the duration of these contractions. And I was on that second setting for about 30 minutes. And my nurse came in and said we don't usually do this at all, but I can see that your contractions are coming hard and fast. I'm gonna lower you back down. And that was really good news for me because they were coming back to back. So that shows me that I was really sensitive to the Pitocin. And once again, my body was already kind of primed to get this baby born. So that was just how my body responded to the Pitocin drip. So I labored like that for a long time. Well, long time is relative, but it felt like a long time. The contractions were intense. They were coming pretty quickly. They were lasting a long time. And my biggest con about the contractions I experienced with Pitocin is that normal natural contractions are supposed to be a wave. You feel it building, you hit a peak. The most sensation you're gonna feel is at the top of that peak, and then it gradually subsides. And then in between contractions, in theory, you should not be in pain. You should feel yourself relax and you should not feel that sensation. The caveat to Pitocin contractions is that even in between my contractions, I was still in pain. I still had that intense sensation in my uterus, that I was still very crampy in between the true contractions. So that is just something to note. I don't think that's the case for everyone, but for myself personally, that was hard because normal labor is designed to, you have your contraction, then you rest. You have your contraction, then you rest. But for me, because I was in pain in between my contractions, there was not that lovely rest period that you would normally have with a natural labor process. Okay, so that went on for a while. I don't know the exact time at this point, but I think it was probably about 10 p.m. My midwife, Rachel, came in to check on me, and I consented to cervical exams. And at that point, she checked me, and I think I was about 6 centimeters of dilation. So things were moving along. I was officially in active labor, and it was okay. My husband and I were kind of working together. I was standing and swaying by the hospital bed throughout the duration of my labor, and we were doing okay. So then we talked about, she's so funny. She was like, this is no pressure. She's like, but I would love to deliver this baby. I think this baby's gonna come soon, but if we break your water, the baby's gonna come sooner. So this is something also to learn about and consider. So if your practitioner, your care provider, breaks your water, this is called AROM, which is artificial rupture of membranes, AROM. So this is when your water is not breaking on its own. They use something called an amni hook to go in and break your water. So I have an image pulled up here. An amni hook is this plastic hook that has a little tiny hook on the end that almost looks like a crochet hook. and they insert it into the vagina, and they can feel your bag of waters, and essentially they take the little hook and nip the hook into the sac, and that is what breaks the water. So I consented to the AROM, and I'm going to hold this up here. You can see that the practitioner inserts the amni hook up into the birth canal, and the hook itself breaks open that amniotic sac, and then your waters are released. So I consented to this procedure. In theory, when you break the waters, labor progresses faster. It's from person to person, it's no guarantee. But if you think about it, your intact bag of waters acts as a balloon or a cushion. So that balloon is kind of cushioning into the cervix, and it is still causing that dilation to happen, but it's not as intense of a pressure as it would be if it was the baby's head. So I would do things differently now, but at the time I was very open to this procedure because I did want to get labor continue to rev up, and I wanted to meet my baby soon. So I was okay with having my waters broken. I will say, when she broke my water, it was a nice relief. It was a giant gush of water. So you lay on the bed. They, like I said, insert the amni hook inside, break the water, and then the water releases. So after that, they get you into nice big mesh panties and a giant pad, and that's going to help kind of soak up the trickles of amniotic fluid that comes out after that. So from there, I knew that after my waters were broken, one, there's no going back, because once your waters are broken, you're kind of on a timeline where you the risk of infection increases the longer your waters have been released. And I knew from the own education and research I had done prior to induction that once my water was broken, that labor was going to really rev up and become more painful. That was the case. So my waters were broken. My husband and I continued to labor. At this point, TMI, I was like, I need to go to the bathroom. So I went to the bathroom, wheeled my little IV pole with me, used the restroom, number 2, and things were intense, very, very intense. This was probably around 11 p.m., so about an hour after my waters had been broken. And at this point, my labor had become a lot more audible. I was really having to work through contractions. I was intense, and I will say movement and using your voice are really important when coping with the contraction sensations. So at this point, my nurse came back in to check on me, and she's like, just checking in. And they knew I was open to an epidural, but also was not like wanting one immediately. And at this point, I think the biggest fear for so many first-time moms is like, how long is this gonna last? Like, am I gonna be like this for 10 more hours? Am I gonna be like this for 2 more hours? Like, how long is this gonna be? And no one has a crystal ball. No one has any idea how long your labor is gonna last. So that's kind of the hard mental game when you're in labor, induction or natural labor. And so at that point, I was like, okay, I think I've gone really far. At that point, I was probably, 8 centimeters long, and I decided to get that epidural. So I will say, it was the anesthesiologist, I think it was actually a nurse anesthetist. That aside, it doesn't matter, but it was the resident, I think, that was in training, and that there was a nurse anesthetist that was with him. So he was kind of observing and making sure that the procedure went well. So he came in to kind of chat to me about the procedure, which is actually like a joke because, dude, when you're in active labor and you're going through intense contractions, the last thing you can do is properly consent and sign off on like a multiple page document. That's for another day, but it is what it is. I consented. And essentially, when you get an epidural, you are going to sit on the edge of the bed, and you're going to kind of wrap yourself around a pillow. And when you're in really intense labor land, it is hard to sit still during an epidural. So I was kind of hunched over a pillow because they want your spine to kind of be curled over, because they inject a needle of anesthetic initially, and then they inject a small tubing or catheter for the actual epidural. the catheter goes into the epidural space of your back, where the medicine goes, and that causes the numbing sensation. So at this point, hindsight is 2020. I did not know that I was already in transition, and transition is your most intense point of labor. So here I was as a first-time mom, not realizing that I was so close to meeting my baby, but I had already agreed and decided to do the epidural. I was really hunched over. I was physically really shaking, which is normal. My husband was nervous because he didn't know what was happening to me at this point. I was very vocal. You could tell I was in a lot of pain. It was the most intense portion of my labor, and I had a needle in my back. And unfortunately, since this was the training resident or whoever, he had to attempt it twice. So like I said, they'll do a local injection of anesthesia first, and then they do the tiny little catheter into your back, and then you get like a big layer of draping like taped onto your back to connect to the little hose. So the first attempt wasn't working, and God bless him, because it was probably really stressful for him too, because I was really in intense, active transition labor, and he's trying to place this catheter into my back. But I will say, after, probably 20 to 30 minutes, he got it placed, and they had the medicine start to flow. So if you decide to get an epidural, which many, many women who have a labor induction will, because there's something called the cascade of interventions. Essentially, one thing happens, and then to address that, you do another thing and another thing and another thing. So I was the prime example of someone that experienced the cascade of interventions, meaning cytotech and Foley, and then the Pitocin, and then breaking my waters, and then the epidural. So it's like one thing happens after another, and this is fairly typical in the medical model. So I had gotten the epidural, and they kind of placed me on my side. They used something called a peanut ball, which looks like a big yoga ball that's kind of smushed in the center, and you put your knees around that. And depending on how long you have this epidural, you're going to kind of be turned back and forth by your nurses to change positions, keep your hips open, and allow that medicine to kind of stay even on both sides. So the epidural had just started, and I was like, honestly, going from those super, super intense Pitocin contractions to the relaxation of the epidural felt really good. But this is the kicker. As soon as the anesthesia started, I felt the urge. And if you've already had a baby, you know this urge. I felt the immense urge to push literally 5 minutes after they left, if that. Like literally as soon as the medicine slipped on, I had the urge to push. So apparently after this experience, my husband told me that the anesthesiologist left the room and said to the nurse, like, she's about to have this baby. And once again, hindsight is 2020. I did not know that I was so close to giving birth, but they clearly saw the signs that I was in transition. And so I let the nurse know. I was like, I am feeling like I need to poop. And that's a sure sign that baby is really close, because when the baby has descended and the baby is very close to being born, they're going to put a lot of pressure on your rectum, which is going to give you the sensation of needing to poop. So I was laying there and trying to relax. Lights were dim. My husband laid down on the couch for 10 minutes. And then I was like, babe, it's time. I know it's time. Like, I'm feeling the urge. He's like, really? I said, yeah, it's time. So he went and got the nurse and said, like, she's feeling the urge to push. So the nurse got my midwife, Rachel. She came in and she confirmed through a cervical check that I was complete. So once again, complete is when you are a full 10 centimeters dilated, that there's no detectable cervix anymore. And I could feel that this baby was low. So the station of your baby is going to also determine really how long you're pushing. If your baby is really nice and low into the pelvis, you're not going to push for very long. So she's like, yeah, you're complete. It's time. So this is where it's like the best thing ever. So I will say I am an advocate for natural birth. I think it's really like the most empowering thing that a woman can go through. However, I really had a positive labor induction experience, and I'm glad that I had it for myself. I'm glad that I can compare the two experiences that I have had, medicalized versus natural. And for me, the pushing phase was like the most exciting and most fun portion of my labor. So I was feeling good. The epidural was really nice because it was working well and it was taking the pain away, but I did still feel that immense pressure, and I felt the urge to push, and I can control my contractions. So they got me all ready to push, and I will say a lot of women enjoy the pushing phase because they really feel like they're using their body and their might to do something, and it's not just like happening to you. And that's exactly what I felt. And you know, if you are pregnant right now, pregnancy feels really long, and I know that it can be really hard. And when you are at the point in your labor where you're pushing, you are at the finish line. You are so close to meeting your baby, and it is so incredible. So like, hang on. Sometimes first-time moms can push for like 2 hours. That's not uncommon at all, but you're gonna get through it, and you're gonna meet your baby. So anyway, it was pushing time, and it felt really good to push. And I am very thankful, but I had a very short pushing phase. So at this point, I had gotten the epidural at midnight, and by the time my midwife had come back in, I had kind of labored down, and it was 1 a.m. I started pushing at 1, couple really good effective pushes, and my baby was born at 1:13 a.m. So I had a very quick pushing phase, and it was so much fun. It was amazing. It was my favorite part of the labor experience with the epidural. I will say, when I was pushing, it was a really good epidural where I was still feeling enough, and I felt something called the ring of fire, which is really common when your baby is coming down through the vagina and stretching out your perineal tissue. You are going to feel a burning sensation. Whether you are unmedicated or not, a lot of women with epidurals will also feel that burning sensation, which is really good because during that point when you have the ring of fire, instead of pushing and blowing through it, you really should take a pause and really kind of breathe your baby down, because stretching out that tissue is going to reduce the chances of tearing. So anyway, my baby was tiny. She was only 37 weeks and 4 days along in her gestation. And she came out really easy for us, thank God. And she came out screaming and perfect and pink and tiny. She was only 5 pounds and 10 ounces, which probably helped me push her out so easy. And I was in freaking bliss, you know? Though this was not the birth experience that I had necessarily wanted or chose. I did choose, I agreed to it. It's not the birth that I envisioned. It was still a really empowering, amazing, positive birth. It was so amazing to have her on my chest. She was perfect and beautiful, and it was the best day of my life, and it changed my whole world, and it's the day I became a mother. So I am eternally grateful to the incredible staff at the hospital. I had such amazing nurses. My midwife, Rachel, was wonderful. And it was such an incredible, empowering experience. So I can go all about the immediate postpartum in another video. I will touch on that. But this was just the process of the labor induction itself. Oh, and don't forget, after your baby is born, your birth is not over. You still have to deliver your placenta. With my hospital birth, I was just like in blissed out baby land, that I was not even like tuned in whatsoever that the birth of my placenta was happening. But the placenta birthed really smoothly. She showed me it. I thanked it literally, and then that was it. And I did have a minor 1st-degree tear with that birth. So when you are anesthetized with the anesthesia of the epidural, the suturing itself is not a big deal generally if it's a 1st or 2nd-degree tear. And then that's it. Then you cuddle and love on your baby. So and a labor induction can be a really positive, amazing experience. I encourage you to do your research about all the pros and cons. as a midwifery student, I really recommend you to learn about what these medical interventions are, how they could impact the health of you or your baby, and the impact of your labor. And like I said earlier in this video, medical inductions are absolutely necessary in some cases. Unfortunately, in our modern world, they're being recommended way too early for no medical indication. So if you're 39 weeks and your practitioner is saying, like, let's get you induced, that should raise a red flag, and you should question your practitioner of why this is something that's being recommended. So I'm not going to go on a soapbox about that. Medical inductions should be saved for medical indications, not just because we're sick of being pregnant and we want to meet our baby. It should be for a true reason, like gestational hypertension, preeclampsia, IUGR. There are multiple reasons of why they are necessary, but in many healthy, low-risk mom and baby situations, they are actually not indicated. So that is your homework to investigate and find out what works for you and your baby. I'm going to wrap it up because this was a long one. I hope this was helpful. Thank you so much for watching. If you are still watching now, please head over to Instagram where you can find me. My handle is Birth and Bloom. I will put it right here. And please like, share, and subscribe if you found this video helpful. Thank you so much for watching. I will see you in the next one. Bye-bye.